Good afternoon, Dr. Lohman. It's such a pleasure to have the opportunity to ask you a few thought-provoking questions today about your work and what got you into it. So let's dive right in with the first one I would love to hear from you about, and that is how did you get interested in studying how the brain and the immune system talk to one another?
Yeah, thanks. Throughout my career, I've been really interested in understanding how immune cells in our bloodstream gain access to tissues in response to injuries, things like cuts or blunt traumas. And I've studied some of the mechanisms that control how this occurs. And over probably the past decade, I've shifted my focus into the brain, which is kind of a unique organ system in that it has these barriers that prevent what we would call peripheral immune cells, are those that are circulating throughout the body from accessing the brain. But we know in things like trauma, mild traumatic brain injuries, like concussions, that these barriers can break down and these circulating or the peripheral immune cells can invade the brain and contribute to both injury resolution as well as further dysfunction of the brain that can contribute to more prolonged deficits and dysfunction.
That's really, really interesting. So, time and time again, I'm hearing this kind of newer to me concept coming up called neuroinflammation. Can you tell us a bit more about that and why it's so important for the public to know about?
Yeah, so neuroinflammation is a very complex series of events that involves both responses from resident immune cells that live in the brain
Mhm.
and invading peripheral immune cells. So we have these resident immune cells in the brain that we call glia that act almost as first responders. They detect when there are perturbations from the normal homeostatic kind of status of the brain, so something like an injury, and respond in a way to initially come in and try to resolve the damage and dysfunction that is there. But if they can't do this efficiently, they will signal to the cells that are in our bloodstream to come in and help get the job done. So we can get peripheral immune cells invading the brain that come in and assist in the reparative and regenerative processes that occur following an injury. So this is kind of what we're talking about with neuroinflammation, but we also know that neuroinflammation doesn't just cause good or beneficial effects. It can also have detrimental effects and worsen the injury or the outcomes following an injury. And we really don't understand what is balancing whether neuroinflammation is doing good or bad things in the brain, especially in situations like head trauma.
Interesting. That's fascinating. And I guess that leads really nicely into my last question for you is how do you feel your work is having an impact and really making a difference and helping people?
Yeah, so my lab studies mild traumatic brain injuries like concussions, and in the Canadian population, nearly 500,000 people experience a concussion every year. And maybe not surprisingly, among these, almost 30% are known to sustain multiple concussions.
Mm.
And what's important to know is that there are really no current treatment strategies available for people who develop concussions, and more than a third of these patients go on to develop what we call persistent post-concussive symptoms,
Mhm.
which can last for months to years following injury. And what
Wow.
we now appreciate and understand is that neuroinflammation contributes in some respect to this prolonged chronic dysfunction that occurs following a concussion, and especially with multiple concussions. So we believe that if we can decipher some of the mechanisms that control that inflammatory balance in the brain, we can develop more targeted therapeutic strategies that will tip the scales towards the beneficial side and improve both recovery rates and reduce the severity of symptoms that people who sustain a traumatic brain injury like a concussion have.
Wow, that is truly fascinating work, real life importance. Thank you so much for your time today and for teaching us about what you do. Thank you.